Hey guys, Dr. Lee here from Head to Toe Spine and Sports. Just wanted to go over a condition we're seeing a lot of in the office lately, frozen shoulder. So another name for this is going to be adhesive capsulitis if you're trying to look it up and just figure out, like, do I have this or not? But you can also watch this video if you're trying to figure that out. So main things that affect people that have frozen shoulder is there's some sort of event that causes us to stop using our shoulder. Like, commonly it could be a broken arm, could be like that we hurt our elbow, could be that you just bumped into something that shoulder hurts, and or rotator cuff stuff. You can't move that shoulder as much as you'd like to. So what we really see in this office, the most common things that we see for the arm is that we can't actually bring it above the shoulder. It gets stuck right here, and there's actually like a stuck feeling to that. Oftentimes there's pain with that as well, but it doesn't necessarily mean there has to be pain. There's 3 different stages to this adhesive capsulitis. There's a freezing stage, a frozen stage, and then a thawing stage. So freezing is usually the most painful stage. That's when you're really restricted in your motion. You have a lot of pain coming on, and that is keeping you from moving as well. Eventually you get to the point where you're frozen, which would be not necessarily painful, but you're going to notice a lot of restriction in your motion, especially when you're going overhead or you're trying to turn inward, like into internal rotation. So what we want to do in this office is get you to that thawing stage as quickly as possible. So the thawing stage is literally the shoulder unfreezing, so gaining more motion, that pain's dying down, the stiffness is going away, and sometimes this happens spontaneously without cause, but most of the time it happens because you're starting to treat the area, you're figuring out what's irritating it to begin with, and you're addressing it. So again, big things that we're going to see are people can't lift up past their shoulder blade, and they also can't reach around behind them. So if they can't reach back and touch the back of your hand to your low back, that in and of itself is going to predispose you to this adhesive capsulitis, this frozen shoulder. So we see this in mostly people that are older, over the age of 40. Typically, generally because they're preceded by some sort of event, and I would say oftentimes it's a rotator cuff injury. So the way that we treat this in the office, just like we treat most things, we use chiropractic manipulation. So we make sure this shoulder joint is actually where it's supposed to be, so it's not internally rotated heavily, it's not externally rotated, it's sitting in a neutral spot of your glenoid, your shoulder joint. So that's going to be super helpful. We might not get there without doing some soft tissue work. So we like to work on the muscles, the biceps, the trapezius, the pectorals, the lats. We need to make sure all those muscles are working in sync because they're massive muscles, they're big movers, and if they're out of sync, they're going to make these smaller muscles like our rotator cuff, even our shoulder capsule, they're going to make that shorten in certain positions. That's going to restrict motion in and of itself. Another thing that we address that's unique compared to other clinics is going to be the lymphatics and lymphatic drainage in the shoulder. There's a big line of lymph nodes along your lateral arm line here, and sometimes it gets full of lymph, which is mostly lactic acid. That can cause spasm, that can cause pain, or that burning sensation that you get whether you're working out or you're just noticing a spasm and you're trying to work against the spasm. So soft tissue work, whether in the form of Graston or ART or cupping, combination of them is likely going to occur. We also like to use laser to heat up those structures, make them a little bit more supple so that they accept movement a little bit more. All in all, we're going to use a big combined approach to start getting things moving, and then we're going to reinforce that movement with corrective exercise on the floor. Give you a home exercise plan, something you can do daily. To start, it'd be with a lacrosse ball, and then progress slowly to more and more dynamic exercises that you can handle. And eventually, we're going to have that arm going overhead. We're going to say hi to our friends. We're going to be waving. We're going to be super happy. So if you have any more questions, if you're not finding the answers that you're looking for online, go ahead and give us a call at the front desk and we'll get you in.